The latest medical research on low back pain is showing us that chronic inflammation, the thing that causes pain and degeneration, traces back to a process called angiogenesis. Now, angiogenesis is the process where the body creates new blood vessels to promote a healing response after an injury to that muscle or joint. Now, in many cases of chronic low back pain, dysfunction is present in large joints at the base of the spine called sacroiliac joints. Now, inflammatory conditions such as sacroiliac joint arthritis can lead to muscle spasms, low back stiffness, and sciatica. Now, vascular overdevelopment of these joints cause two problems to occur that lead to pain and degeneration. The first problem happens when irritating nerve endings grow off of those additional blood vessels, and these fire pain signals to the brain. Now, the second problem occurs when blood vessels flood the joint with inflammatory hormones and cells that eat away at the cartilage and cause joint destruction. Now, treatment options such as steroid injections and medications provide short-term relief for the inflammation, but usually the pain returns after a couple of months. So that leaves us with our other option, which is surgery. And surgery is invasive, it has a long recovery time, and it isn't even guaranteed to relieve your pain. Now, we understand your frustration. These are not great options. Now, our integrative office combines a non-surgical procedure that targets inflammatory blood vessels called embolization. With advanced physical therapy techniques, along with that procedure, we can restore function and eliminate the cause of pain and degeneration. Now, our protocols are safe and effective for everyone, including those with diabetes, osteoporosis, obesity, and if you've tried and failed other things like injections, this is a perfect thing that can get you help. Now, if you're the type of person that wants long-term solutions that don't involve surgery, then we are the perfect place for you and your loved ones.